Well, I think as all of us as dentists, as restorative dentists, we all have had cases where, let's talk about a class two on a second or first molar. Class two restorations compromise the proximal walls of teeth, and these proximal walls compromises could be either shallow or they can be deep. When I say deep, we're talking about having the floor of that box very close to the gingival margin or gingival tissue, or even underneath the gingival tissue. So if we stop and think about that for a minute, when we're in that kind of clinical situation, how easy it would be for us without a rubber dam to control either bleeding of the tissue or curricular fluid present in the gingival sulcus. We all know that both of those are going to contaminate that margin. They're going to affect the way that our bonding procedures should be performed on those areas. So if we really want to look into our restorations and we want to think about them and we want to deliver them in a way that they're predictable, long-term wise, we want to make sure that we isolate so that we can separate either the curricular fluid or the bleeding from the surrounding areas of those deep margins from the actual tooth structure that we want to restore.